Namaskar, Assalamu alaikum, Sat Shri Akal, Vanakkam. It is indeed a great pleasure when patients who have opted for other systems of medicine, their medicines do not act, and when homeopathy is opted for and homeopathy is given correctly, there is a marked reduction in the pathology and the symptomatology. So here is a case of a 77 years old gentleman who presented to us roughly in June of 2023, and this man has colonic cancer, but when it was detected, it was already spread from colon to the liver. So we have a scan of 12/6/2023 with multiple hepatic metastasis and average size measuring of 5.6 into 5.2 centimeters. Anyway, so before coming to us, this started developing somewhere in February or March 2023. Initially, this gentleman started having alternate constipation with diarrhea. He took some local medications, and slowly and steadily they came to the conclusion that he is suffering from malignancy of the colon, but which when it was detected, it had already spread to the liver. They gave him chemotherapy. Unfortunately, he reacted adversely to chemotherapy. He started having chest discomfort, severe palpitations, his blood pressure started elevating, and he strictly refused chemotherapy because he could not tolerate those symptoms. They tried to change the chemotherapeutic drugs, and yet he kept on giving adverse symptomatology, mostly cardiovascular symptoms to these drugs. Irregular heartbeats was one of the very, very important symptoms, and the pumping capacity of the heart had come down. It was this scenario that the patient came to us, and since they were basically concerned with now both malignancy as well as the cardiac problem which he started developing, and was not going even after stopping the chemotherapy. So in June, I saw this case. We worked up the entire case, and we had to see primarily that the tumor size, the malignancy, the hepatic mets as well as the colonic malignancy should decrease, as well as the symptomatology, because he was already showing signs of hepatitis, yellowness of the conjunctiva, icterus was there. He had lost all his appetite, thirst was moderate. There were no remarkable classical PQRS symptoms to prescribe upon. So we took the ailments from the time when he started with malignancy, somewhere between February. I said, what exactly happened? And he gave us an event which actually had shaken him mentally somewhere in December of last year, and that event actually was of profound grief, to an extent that he wanted to commit suicide. He didn't want to live because it had something to do with his very close family members targeting him, and on this basis we started him with aurum metallicum, and aurum metallicum was given 200 single dose, repeated after 15 days, again 200 single dose, then 1 ml, that was in June, placebo. Then in between we had to give him Nux vomica for certain few of the symptoms which is settled down. Then the last CT scan of the whole abdomen which we did was on 21st of September 2023, and here it has shown half, the pathology has decreased half the size. In July itself, after the first dose of aurum metallicum, he started feeling symptomatically much better, appetite had increased, and the yellowness had markedly reduced. Over a period of time, his symptoms began evaded, and he started gaining weight. He started going to work. At 77, he is a businessman, and he was not doing business since past so many months. He did not want to live. He knew about the diagnosis, but he was perturbed because there was no hope. Because the day it was found out, it had already spread and it was already declared to be stage 4. So he had no hope. And now, after seeing this result on the 21st of September, he is elated. He is now a very, very active participant himself. He was taking homeopathic treatment just for the sake of taking homeopathic treatment, but then, and even in spite of lot of counseling, there was no much results. But now he is so positive that now, doctor, I now want to get well. Of course, we counseled his relatives who had actually unintentionally gave him a trauma enough to start the malignant process, as we believe in homeopathy, and with aurum metallicum only, and now it's 0/4 which is going on. 10 mg single dose is going on, not 0/4, and it has shown a remarkable recovery. Hopefully, we'll continue follow up probably for 1 or 2 years and see the results. So, this remedy given individualistically not only will treat the malignant process, the malignancy, but now he has got no cardiac problems. The ECGs are normal, the palpitations, the ghabrat, what the symptoms which he had gone because of the chemotherapy drugs, which we had hoped that after chemotherapy the symptoms should go away. But then he had never in his life had those symptoms. It were classical symptoms of the drug which had administered, because it occurred immediately. We tried that, when they had tried that, even with those symptoms they should have given the drug, but then he refused, and here with homeopathy we have got these results. So friends, all in all, I want to say that homeopathy can really heal if given correctly. Thank you so much.